morning, everyone. My name is Dr. Lovey Singhal. I am consultant orthopedic surgeon, Apollo Miracle Hospital. Today, we'll be discussing about most common spinal disorders and their treatment. The commonest spinal disorder which we come across in our day-to-day practice is slip disc, or as in layman language, some people call it as sciatica. So slip disc is something in which there is a intervertebral disc, which is cushion-like structure present between the two bones of the back or say neck, which when moves out of its position starts pressing on the nerve supplying legs, or when it happens in the neck, it starts pressing nerves of the hand, and it causes pain in both neck and lower back, as well as this pain travels down to our hand if its neck is involved, and to our legs if lower back is involved. Also, there is associated tingling and numbness. So this is the most commonest problem which we see in our day-to-day practice. Patient comes with severe pain and stiffness in back, along with pain traveling down from a back to the legs, or pain in the neck which is traveling down to the hands. The treatment includes giving rest to the body part, then giving some muscle relaxants, hot fomentation. If slip disc is severe, that means if the disc is pressing too much on the nerve root, then seldomly these patients require surgical intervention in which we remove the part of the disc that is pressing on the nerves. Second most commonest disorder which we come across and which is generally seen in elderly population is lumbar canal stenosis. In this disease, the place where the spinal cord is passing behind our backbone generally gets compressed due to narrowing of the space, as the name indicates, stenosis. Stenosis means the compression. So such kind of cases again require rest, and in severe cases where there is associated tingling, numbness, or even there is loss of power, such cases require surgical intervention in which we have to free up the space near the spinal cord and make it roomy so that the pressure is relieved. Third most commonest problem, which is again seen in geriatric age group, or even it is seen in young individuals due to trauma, is spine fracture. It is very commonly seen in elderly population due to loss of calcium in the spine, which is called as osteoporosis. Treatment includes rest, giving brace support, giving higher dose of calcium and vitamin D3 supplements. In very rare cases, we have to surgically intervene, in which we have to stabilize the spine so that this fracture doesn't cause any neuro. Another more commonest problem which we come across is called as ankylosing spondylitis or bamboo spine. In this, the various bones of the back fuses with each other and appear like a bamboo. That means a straight and a stiff spine. Patient comes to the OPD with stiffness in the back or hip joint or the neck, severe pain while moving the neck or back. Such patients are diagnosed with the help of blood test and the X-ray, and the treatment generally includes rest and medicines to decrease their pain. Uh, Next commonest problem which we come across is deformity of the spine, which is called as scoliosis or kyphosis. Scoliosis is the sideways deformity of the spine, in which spine is bent sideways. This gives the cosmetic deformity. The deformity is cosmetically visible, and again in kyphosis, there forward or the backward bending of the spine. In both the cases, when the spine is bent or deformed, the treatment part includes correction by surgical intervention. Rarely, another spinal disorder which we come across is the tumors of the spine, in which there could be malignant or benign tumors which are non-cancerous. If these tumors are not causing any neurological problem, we might observe these tumors provided they are benign. If they are malignant, then they have to be tackled by surgically removing these tumors. Even if the benign tumors are causing neurological deficit, then these tumors have to be removed surgically. So these are some of the commonest problems which we come across in Indian scenario is tuberculosis of the spine or spondylodiscitis, which is bacterial infection of the spine. Such patients might present with neurological deficit. They may or may not be constitutional symptoms of tuberculosis like weight loss, loss of appetite. Uh, Such patients are treated with the help of antibiotics or anti-tubercular treatment. If the treatment is not helping them out, then seldomly they require surgical washout or cleaning of the area, which is called as debridement. Lastly, some people come in the OPD with back pain after lifting heavy weights, or maybe due to some jerky movement. So they just have the muscular spasm. So in these kind of patients, we categorize as the spondylitis, and these patients generally require a good muscle relaxant, some hot fermentation, and rest, and they generally settle well with this treatment. So these are some commonest spinal disorders which we come across in our day-to-day practice. Thank you very much.